The path to becoming a nurse could soon change. The federal government has a plan to cap federal student loans, which could restrict nursing students' access to enrolling in degree programs. This is starting a lot of conversations about how nurses are trained, how much they're paid, and even how the role itself is viewed.
Dr. Natalie Gentili joins us on the Wellness Wednesday to talk about all of this.
Yeah.
Dr. Gentili, thank you so much for being here. Basically what we're talking about is the federal government wanting to cap federal student loans. Is that correct?
Yeah, student loans are extremely important to those of us in professional degree training, right?
Yeah.
And for a lot of us, that's the only way for us to get through these training programs. When you put caps on how much money someone's allowed to borrow, that can really limit the number of people who can come into these programs successfully.
Yeah.
So from your perspective as a doctor, I mean, you understand for some of these professionals that need to go through these programs how important their roles are in all of this. So when you hear about this happening, what is, I don't want to say your worst fear, but what are you afraid could happen from all of this?
I mean, to start, I'm here as a physician to support my nursing colleagues. These people are incredibly important to the team to take care of patients. And if patient care and quality of care and safety is the ultimate goal, if we are going to limit the number of people that can truly go through these programs, become professionals in their field, experts in their field, we are going to end up hurting patient care.
Yeah.
It's my understanding that we're talking about advanced degrees in nursing. So in other words, if someone is getting, I hate to use the word basic, but the 4-year degree of nursing, they're still eligible for the student loans, the federal student loans, I should say. However, if they want to go to one of those advanced degrees, for example, a PA, which is so important in our world today, because whether we're talking about underserved communities, rural communities, so many doctors, the biggest hospitals and doctors' practices out there rely on these PAs. These are the types of people we're talking about. And there's already concern that nursing and support is being put on the chopping block. Are you seeing that?
Sure. We have major shortages. In my field particular, I can talk about primary care. Major shortages across our country in primary care. And when you talk about rural settings, tribal communities, where most of the times these are nurse practitioners, physicians, associates that are able to go there and take care of these communities, if we bring down that population of people who can qualify, who can afford this type of training, that is absolutely not going to help access.
Yep.
Yeah. And these next step physician's assistants and after nursing, what are their roles? Can you walk us through what that might look like? Like, who are these people specifically?
Yeah, a healthcare team is really big, right? It's composed of a physician. It's composed of usually a nurse practitioner, a physician's associate. There's nursing involved. There's usually, support staff around that. And they are all super important for making sure that a patient gets through a healthcare setting with comprehensive care. And so, a lot of times physicians are assigned 2,000 to 3,000 patients in a primary care practice.
Wow.
There's no way that one physician is going to see all of those people and be able to care for everything that's necessary that comes through for that patient. And so you've got this team for a reason.
Let's bring this down to a practical focus. How will this affect your practices today, next month, next year? What are you seeing?
And for the patients too.
Yeah. So for example, I do a lot around teaching in medical schools, okay? And so if you look at the teaching community, if you look at programs that are training nurses, for example, they're not going to get as much funding anymore. So on a today basis, probably not much of a difference. But in the next couple of years, these programs are going to have cuts to their funding. And if we have cuts to funding because they're not professional anymore, they're not considered professional programs, then less people are going to have high quality training. You also look at people who can't afford to go into training without some type of federal loan support.
Yeah.
They're going to have to go to private loans, which are a lot of times more expensive. Or they're just not even going to be able to go into it. So if you don't have generational wealth, if you're not going into a training program with money already, it's unlikely that you're going to have those communities represented. And we really deserve a broad, diverse community of people taking care of a broad, diverse population.
Yeah.
Oh, important conversation.
Important stuff, very much so.
Thank you so much, Dr. Gentili. And if you are interested in learning more about direct care physicians of Pittsburgh or Rebel Wellness, head to our website, kdka.com/talkpittsburgh.
All right, and coming up here on Talk Pittsburgh, from a hole in her heart to a future in medicine, Alexa White's journey is nothing short of inspiring. This former Free Care Fund telethon co-host is now a third-year medical student chasing her dream to become a pediatric cardiologist. Her full circle story next.